Let's talk then about the health service. You have said the health service is under threat today. This morning, Nicola Sturgeon began the day by saying 100,000 of our most vulnerable citizens are in threat of losing their benefits. Isn't that Project Fear? Isn't that what you've been accusing your opponents of?
Well, the Project Fear is the ridiculous succession of scare stories that come from the No campaign, pointing out that the inevitable consequence of the privatisation and fragmentation of the health service in England under current circumstances...
Spending in the health service in England has been going up. Yeah, you know that as well as I do.
Well, the Labour Party, the opposition in England, say that there's a huge privatisation agenda which is designed to reduce and destroy the National Health Service. What we're pointing
and you always agree with Labour?
No, but what we're pointing out, well, the facts agree on this case. I mean, we can see the disintegration, the fragmentation that's happening. Now, that is designed to reduce spending on the health service. That's what it's designed to do. Under the current arrangements, for every £10 effectively spent in England, Scotland gets £1. If you reduce expenditure in the health service in England, it has a knock-on consequence, unless, of course, we gain control of our own taxation, our own spending, and can protect our health service. And what we say is, to reinforce that, there should be a constitutional protection. We should build that into the new constitution. I mean, the UK, unlike just about every other country in the world, doesn't have a written constitution. Not only do we want to have a written constitution, we want a written constitution that gives a constitutional guarantee to a health service in the Nye Bevan principle, free at the point of need and properly financed from the Scottish Exchequer.